for diabetes when they get their insurance checkup done. So therefore, we realize that both hypertension and diabetes can continue to damage your health without your knowledge, uninterrupted. Can we prevent? Certainly not prevent, at least postpone by controlling diabetes and hypertension, provided you know it. When we talked about sudden cardiac death, and then we came to know that a lot of people, especially startlingly more in the recent past, that one Dr. Prasanna Naidis, the director of cardiology at KEM Hospital, dropped dead soon after the coming back from gym. I don't remember the name, but 23-year-old girl, while she was performing dance on the stage, collapsed, and she was no more. This unfortunately happens while the people are at zenith of their career. They have young children, they are about anything between 30 and 45. So this is disaster, big calamity to the family. This problem is very enigmatic. The problem is that the patients do not come to a doctor until they have symptoms. The doctor may fail to detect any abnormality because most of the tests are coming normal in them, including even a stress test. The reason is simple. The blocks in the coronary artery, which is made up of fatty acids and cholesterol, exist into the coronary arteries, and then there are about 30-40% they are not detectable, neither by any ancillary medical investigation nor patient notices any symptom. What happens is due to sudden stress, like external stress or internal stress. By the external stress, I would say rigorous exercise, which raises the blood pressure and which raises the pulse rate to a very high level, and that plaque, which is only 30-40%, and if it is covered by a thin membrane or a thin cap, it ruptures. When it ruptures, this plaque, which is only 30-40%, over a period of minutes or hours, it becomes 100%. When it becomes 100%, it precipitates heart attack. No tissue in the body can remain alive without blood. So that part of the heart where this artery is supposed to carry blood, gets no blood, and heart attack is supposed to have ensued. 50% of people who sustain heart attack are unable to reach to the hospital because of sudden death. Now, 65% of the patients who get admitted in our hospital with heart attack did not have any symptoms whatsoever prior to their admission to the hospital. So then I think it becomes very, very important that we find out and weed out from the society who are those individuals who are at a high risk of developing sudden catastrophe. If we come to know that these are the people who are at a high risk of developing sudden heart attack and sudden cardiac death, then I think we can intensively treat them, and in vast majority, if not all, we may be able to successfully avoid precipitation of heart attack in them. We are not finding a single effective program in Maharashtra state, and it's a shame that the medical profession has not paid as much attention as it ought to have given to this aspect of health. Prevention is a very important aspect of healthcare, and prevention is a very important aspect of medicine. We don't have to necessarily treat diseases, we have to prevent diseases, and we want to popularize this concept. We want to encourage people to come to us irrespective whether they have symptoms or no symptoms, and give us an opportunity to find out, evaluate them, so that we can be helpful in preventing such catastrophe. And this is entirely the aim and objective of this program which we are going to launch. This is what I am saying. Right, sir?